Hi, my name is Dr. Coulter, and I'll now be talking about obstructive sleep apnea, or OSA, and treatment options. OSA is when the airway gets blocked during sleep. The muscles in the back of the throat and tongue relax. They fall back and stop airflow. This repetitive choking is terrible for you. Oxygen levels drop, sleep is fragmented, and not only can it cause snoring and restless sleep, but also excessive sleepiness during the day, headaches, and memory issues. It increases the risk of heart attack, stroke, diabetes, and even car accidents. A sleep study is what helps us diagnose OSA. This may be done with a kit at home or spent overnight in a sleep lab. This may result in mild, moderate, or severe OSA. You may have poor sleep, but technically not enough choking episodes to be diagnosed with OSA. Better sleep starts with good sleep habits. Try to go to bed at a consistent time without stimulating activities beforehand. Avoid alcohol or sedatives before sleep. Many people with OSA choke less while sleeping on their side. There are even devices you can buy that help push you to your side. However, this can be hard for people with shoulder and hip issues. Weight loss can be very helpful for those overweight. A 10% weight loss can lead to about 25% reduction in the amount of choking and can improve symptoms. The traditional treatment for OSA is positive airway pressure, commonly called CPAP. It can work well, but is commonly very hard to use regularly for a variety of reasons. Sleep doctors can try adjusting pressures and different masks, but the cited adherence rate is still only about 50%. Patients need options beyond positive airway pressure. Mouthpieces, called oral appliances, can be worn at night to slightly pull the jaw forward to prevent the tongue from collapsing. This is best for simple snoring without OSA or mild OSA. It can be used in combination with other treatments. After trying conservative measures, surgery may be a good option. The best surgery for each patient is unique, depending on how the upper airway collapses. We perform a camera exam that passes through the nose and looks at the upper throat to assess this. If performed while asleep in the operating room, this is called drug-induced sleep endoscopy, or DISE. Improving the nose airway is commonly a good start. Surgery for the back of the throat may also be an option. The tonsils are typically removed and the back of the throat widened. This is typically very painful, unfortunately. Another option is a procedure called airlift that involves two small incisions in the neck to open the lower part of the throat and tongue. This is a model of the jawbone. The airlift procedure involves strings that pull a throat bone called the hyoid, as seen here, towards the chin. And then it's anchored with small screws. The biggest advance in OSA surgical treatments is what's called hypoglossal nerve stimulation. A company named Inspire has developed technology like a pacemaker that sits in your chest on the right side. There's a remote you use to turn the device on at night. When you breathe in during sleep, it sends a signal to the nerve that controls your tongue in order to stiffen it and prevent collapse. It involves one incision in the neck and one in the chest. You can go home the same day after the surgery. Pain is typically moderate afterwards. We turn the device on after 1 month. This has worked very well for patients with moderate to severe sleep apnea. I hope to discuss further details with you soon.